Hi, everybody. Welcome to the Ask Julie Ryan Show. I'm Julie, your host, and I'm so delighted you could join us this week. My intention in doing this show is to provide information, insight, and comfort to people all around the world by helping to answer life's unanswerable questions. And we have a whole bunch of callers on hold, so I will get to them in just a minute. Wanted to give you a little bit of an update here from Sweet Home, Alabama. A couple of weeks ago, my son Jonathan was home, and he's the center of the universe and all of that. And he came home again today with his wife Mallory because her grandmother passed last week. So if you would keep Mallory and her family in your prayers, I would appreciate that. A couple of interesting things about her grandmother. She was born and raised, her name was Rosa, and she was born and raised in Nuremberg in Germany, and was a little girl during World War II. And during the air raids, she and her family would have to go into the underground bunkers. And she had marvelous stories about that, and really a strong, strong woman. And you know how you've heard me say over the years that we all decide when we go, where we go, how we go, and what the circumstances are when we go? Well, Rosa, I think, is a great example of that because she fell about a month ago and broke her hip, maybe 6 weeks ago, broke her hip, had surgery. She was in a rehab place for a few weeks. She got to go home. And then a week ago, she fell again and was hospitalized again. And the family was talking about that they were going to have to put her in some kind of a nursing home because it just wasn't safe for her at home, even though she had her daughter that was there with her as a full-time caregiver. And she made it very apparent to her children that she did not want to go in one of those homes for old people. And so they said, Mom, we really don't have a choice. It's for your safety. So she died in her sleep on Friday night. She just went to sleep and she didn't wake up. And so my hat's off to Rosa when Jonathan and Mallory called us. It was about midnight Central Time when they called us Friday night to tell us that she had passed. And I said, I'm so sorry, Mallory, for you and your family, and I'm thrilled for your grandmother. So I think that's a remarkable story and another indicator about how we all really do choose when we go and where we go and all of that. So a couple of bright lights in this cloud. Number one, we'll be at the funeral tomorrow. So it's in Huntsville, which is a couple of hours north of us. So Tim and I are going to go to that. And the other, obviously, big bright light is that Jonathan's home. I get to see him twice in 2 weeks. And the really amazing thing is Rosa gave me a gift because he's going to be home for Mother's Day for the first time in 6 years. So I'm thrilled about that and grateful to Rosa that if she was choosing to go, that she did it in a way that I get to see Jonathan and Mal over Mother's Day. So there's always a silver lining to every cloud. Just wanted to share that with you all. So please keep Mallory and her family in your prayers. So, all righty, let's go to the phones. And our first caller is Joan. Hi, Joan.
Hi.
How are you, girl?
Okay, so, my good news was you were right. I called a couple weeks ago, and I don't have thyroid cancer. I had to get 2 biopsies and molecular testing, but wanted to let you know you were right about that. So I was very relieved.
Wonderful. Wonderful. Congratulations. I'm thrilled for you, too.
Thank you. Yeah, it was a huge relief. But I am having an issue that I've talked to you about before, and that's frequent urination. And you suggested I go to a gynecologist and a urologist, and I've seen the gynecologist, and she thought that it was just low estrogen, so I'm back on hormones, and she didn't think I'd need to see a urologist. It was dramatically better, and now it's acting up again.
Okay. All right. Joan, please tell everybody where you're calling in from.
San Luis Obispo, California.
Okay. All right. Terrific. So am I remembering correctly that I did a procedure on your bladder when you called in before?
Yeah. You said that it was interesting. You had never seen this before other than you had a private reading with a man who had the same kind of issue. I'm not sure what the part of the anatomy was. I wondered if it was the urethra. You said something about, I thought you said something about a narrow tube or something that needed to be replaced. Was something you said it was something very unusual, and it was ironic that you had just had a reading with a man who had similar issue with whatever this part of the anatomy is.
Huh. All right. Well, I don't know if you've heard me say before, but I don't remember what the healings are when I do them necessarily because I'm in and out of different realities. So if you prompt me, I can usually go back and pull it up. And when my teacher and mentor told me that 30 years ago, I thought, that is the weirdest thing I ever heard. And you know what? She was right. And I'm the same way. And all my graduates are the same way. So we're in and out of different realities. Let me get you on my radar and let me see what's going on. What's coming in my head before I even get you on my radar is to tack your bladder up. So here we go. Here comes my laser beam from Sweet Home, Alabama, heading out to you in San Luis Obispo. What I'm doing for those of you that are first-time callers is I raise my vibrational level to the level of spirit because we're all spirits attached to a body having a human experience. And when we're attached to a body, we vibrate more slowly simply because the body has mass. So I raise my vibrational level. I watch a laser beam go to California to hook into Joan, and it's like I have a hologram of her in my mind's eye. And then I can see body parts, and I watch healings happen, and it's spirit working through me and with me to help do these healings. So I've got you on my radar, Joan. Shooting energy from your feet up through the top of your head. Yeah, your urethra looks clear. What I'm watching is what I was getting in my mind before I even got you on my radar, which is tacking the bladder up. So I'm tacking it up in several different places, and you know how my analogies are really hilarious at times. This reminds me of, like, have you ever seen, and maybe in your life you've done this, when I was growing up, sometimes if it was a nice day, my grandmother or my mother would hang sheets and other clothes on a line to dry so they could get that fresh air smell, and you'd put a clothespin, in different parts of the sheet, and it would have swoops kind of in it. That's what the bladder looks like when it gets tacked up. So just did that. Is it in Joan's best interest to see a urologist? I'm getting a yes. It is. I would get a second opinion, and I would go to a urologist on that.
Yeah, actually, I just remembered something. You had said before the bladder had dropped. I forgot you told me that. And I told the gynecologist that I thought that was going on. Obviously, I didn't tell her I consulted her, but she said, "Oh no, it's high up. It's fine. I think it's just estrogen deficiency." But I told her I wanted to see a urologist, and she said, "See a urogynecologist." Because there's also this hormonal issue. So that's what I'm going to do, but I wanted to know, I'm guessing it must have dropped again or something because it was so much better, and then for no apparent reason it's acting up. So I will follow up with that. Yeah, thank you.
Okay. All right. Feel better. Let us know how you're doing. Thanks for sharing your news. That's fabulous. Okay, take care. Bye-bye.
Okay.
You bet. Bye. All right, let's go to Miss Sarah next. Hi, Sarah. Hi, Miss Sarah.
Hi.
Hi, how are you?
Thanks for taking my call. And
you're welcome.
Prayers to your daughter-in-law's family. Really love
Thank you so much. Please tell everybody where you're located.
I'm located in Berlin, Germany.
Berlin, so you know where Nuremberg is.
Yes.
Yeah.
I do, yeah.
I'll be surprised if the family tomorrow, you know how they have a luncheon after the funeral usually or some kind of a get-together. I'm hoping they have all German food there because I love German food.
Oh, really?
I'm hoping that. I think that would be such a nice tribute to her, don't you think?
Yeah, for sure. That would be
fun. She made a wicked German potato salad, boy. Woo.
Okay.
Yeah. How are you, girl?
That's great. I'm not that good at the moment, so the reason I think my yeast issue is getting better, slowly getting better, which is good, but I've been having right now the third UTI in 6 weeks.
Oh, jeez.
And yeah, it's always after intercourse, and it just I've even taken now, because I had this issue in the past, it went away for a while, and then it started again, and I'm even already taking preventive antibiotics, because the urologist said I should just take like a one-time dose after sex and so on, and still it doesn't help, and it's really difficult to get rid of. It's not even, I'm doing all the things like peeing afterwards, drinking tons of water, and doing everything, but it seems like it came back, and I'm just wondering like why. It's really insane for me. It's so painful, and it's like the third time in 6 weeks.
Okay, so I think it's important to let your body heal. I would be abstinent for a while and let it heal, and then you can get off the antibiotics, would be my guess. I'll check you at the break, Sarah. Everybody, we're going to take a quick break. You're listening to the Ask Julie Ryan Show. We'll be right back. Stay with us. Welcome back, everybody. Before the break, we were talking with Sarah in Berlin. And Sarah, I did a healing on you over the break. And what I saw was crystals in your urethra from your urine. There's something that's generating crystals. And I think that's irritating the urethra. And then bacteria and stuff gets in there. And that's why they've got you on the antibiotics, which is a nightmare for you trying to clear up your yeast and your gut issues. So what I did was a DNA healing on the crystals. What I'm getting is abstain for a month, let your body heal, and do your best to get off the antibiotics and stay on the nystatin. And pay attention to your, but it's the nystatin doesn't have a chance because you keep having to take the antibiotics. So so that's what I'm getting as far as a suggestion for you.
And those crystals, do you think I need additional treatment, or are they going to go away?
I think they're going to go away. I think you just need to let your body heal. So I need you to play Sister Mary Sarah for a month, and then let your body heal, and then let's see how that goes. Okay.
Okay.
I hope you feel better.
Away again. Okay.
Yeah. I hope you feel better. Okay. Thanks for calling. Go to bed.
Julie.
What is it, like 2 a.m. there?
Yes, it's 2:23 now.
Oh, God love you. All right. Now. Well, go to sleep.
Thanks.
Sweet dreams.
Yes, I will.
Okay.
Bye.
Bye-bye.
Bye, Julie.
All righty. Let's go back to Miss Christy. Hi, Christy.
Hey.
Hi, Christy. How are you?
Hey. Good. How are you?
I'm wonderful. Thank you. Where are you located?
I'm Kingsland, Georgia. Right on the far south as you can go, before you get to Florida.
Oh, terrific.
And we did a reading with you. I don't know if you remember. I know you have tons, but me and my kids, I don't know, Avery, Kate, and Brayley, and then we had a dog, Katniss.
Yes. Yeah. How is everybody?
We're actually kind of sad. Well, Katniss, it was our golden retriever, which had cancer, and then you did a scan, and that's 2 years ago. But she's gotten sick again. I didn't know if there was anything else we could do to help Katniss. So she just went down so fast. So actually, we're a little sad. Avery's about to graduate from college. This one ceremony's this weekend, the next weekend, and little Katniss got sick. So I was just, let me try. Because you said reach out again.
Yeah. I'm gonna connect to you, Christy, and then from you, I'm gonna get to your dog. Okay, and your dog is Catnip, right?
You. Katniss,
spell it for me.
I'm just went blank. Katniss.
Katniss.
Hunger Games.
All right.
Off of Hunger Games.
Oh, I was thinking you were saying catnip, but I was saying, what a great name for a dog. Wouldn't that be a great name for a dog, Catnip?
That would be, wouldn't it?
I know. Well, congratulations to Avery. So, all right.
Thank you.
Here we go. Here comes my laser beam. And then we're going over to Katniss. All right. Katniss's spirit is out of it's a she. Katniss is a she. She, it's out of her body. So she is dying. So let's talk to her. Katniss, are you ready to go? No. Are you in pain at times? Do you want to be euthanized? Not yet. When will the family know that the time is right and you're ready? When I can't control my bowels. I hear that a lot, Christy, from animals. That seems to be the big marker that animals tell me if they want to be euthanized. But she's not ready to go yet. So
I didn't think, look how I'm crying, because she's so sweet. I didn't think she was. Because I can tell that I can't do that yet. I don't feel like, because
you'll know when it's right. She'll let you know. You can ask her. Just say, "Hey, Katniss, do you want to go on?" And she'll answer you, and it's going to sound like a thought in your head. But how you know that it's her? It's going to come in within a second. As fast as you can snap your fingers, and then you'll know that that's her. So let's ask her if she needs anything. Just to be with the family is what she's saying. So she's asking you to be patient with her.
Because I cry a lot,
No. Yeah, sure. Okay, so enjoy her while she's here. Know her spirit will be around you when she goes. Get my book, Angel Messages for Dogs. Have you seen that yet, the children's book?
Oh, I have. I have to talk about it, but I have not.
Order it. The drawings are... Yeah, the drawings are fabulous. It's got a picture of Jonathan in it with our late dog Katie when he was 7. She was his first communion present, and she was a puffball. And then there's a picture of my daughter-in-law, Dr. Mallory, in there with her dog, Rooney. So it talks about dog spirits and stuff. It's really cute. So order that for yourself and your family.
I will get that.
Thank
you. I didn't know what to do. The vet was saying, well, maybe y'all should make the decision. But I was like, well, I just didn't feel like it was right yet, because she didn't seem, she won't
She's not ready to go yet. I agree.
I can't get her to eat or anything, but I'm just trying. But she will drink.
Good. She'll let you know. But when she can't control her bowels anymore, then you'll know that the time is near. Okay. All righty. Hope that helps.
Thank you so much. You're blessed.
You're welcome. Great talking with you. Take care.
Good talking with you. Bye-bye.
Bye-bye. All right, let's go to Roxy next. And let me find you here. Here you are. Hi, Miss Roxy.
Hi, Julie. Thank you so much for taking my call.
You're welcome. Please tell everybody where you're located.
I'm in Sydney, Australia. Originally from LA.
Yes. Well, wonderful. What time is it down there?
It's 10:30 a.m. on Friday.
I know. We're talking to her real time in the future, you guys. Roxy, I mean, how sci-fi is that? Forget woo-woo. We got woo-woo and sci-fi with you, girl. How fun is that? We're gonna take a quick break. And when we come back, we will get your question, Roxy. So everybody stay with us. You're listening to the Ask Julie Ryan show, and it'll be fun to see what Miss Roxy has to ask from Sydney, Australia. So stay with us. We'll be right back. Welcome back, everybody. Before the break, we were talking with Roxy in Sydney, Australia, and it's already Friday morning there. So we're talking to you real time in the future, Miss Roxy. Thanks for calling in this morning for you, this evening for us here in the U.S. Do you have a question for me?
Yes, I do, please. I'm calling because I have some fibroids, and last year and the last period of finishing my PhD, I worked with a narcissistic supervisor, and it was very stressful. He threw stuff at me during one of the meetings, and then I had a lot of issues changing supervisors, and the fibroids grew during that period. I was very down emotionally, and I don't know what happened, but I can feel that one has grown all the way on the left side under my breast, and I look bloated and pregnant, and I would want them to go away naturally. If there's something that I can do or something that I can change to do it, because the surgery is high risk if I have it and I could bleed out. And I do want to have kids at some point, and something's wrong, but I can't figure it out. It's, I just can't get them to reduce naturally, and I keep putting on weight, and I just want to change. So I was wondering if there's anything you can guide me towards or anything that can be done, please.
Absolutely. I'm going to do a healing on you with the fibroids, and I'll do that in a minute. But the other thing that's coming into my head, Roxy, I'll get you on my radar in just a second, but I get information downloaded into my head usually simultaneously while I'm watching a healing in my head, and then also oftentimes before I even get a visual. And what I'm getting is that your hormones are out of whack. So it makes sense for you to, I would find somebody who specializes in bioidentical hormones. Have you ever heard of that? Bioidentical hormones? Yeah. And how young are you, Roxy?
I'm 38, so I want to get rid of them and, work on a family.
Yeah. So I would find somebody to get your hormones regulated, and they'll get you back to a level playing field with that. But what I'm going to do here comes my laser beam heading way south from me and coming around. Okay. It takes a second. It's so funny because my laser beam, if it's somebody close, it takes just a nanosecond. If it's somebody a little bit farther, I think it's an 18-hour trip or something from Alabama to Australia. I have a friend who lives in Melbourne, and it takes a long time to get there. So, okay, got you. Shooting energy from your feet up through the top of your head. Okay, you've got more than one in there. Yeah. So what I'm doing is I'm removing the fibroids, and then what we're going to do while those are getting removed is I'm going to do a DNA healing, like what I did on Miss Sarah, from Berlin. This must be the International DNA Healing Show here already. And so I've watched a strand of DNA come out of a chromosome, a big X chromosome. And it looks like a piece of paper that you would see in a fortune cookie with the fortune written on it. And it has the sequence of DNA. DNA is made up of 4 nucleic acids, and they're represented by 4 letters, A, T, C, and G. And there can be 100,000 letters on a strand of DNA. There can be up to 1 billion letters. I'm watching those letters get resequenced because there's been some kind of a mutation that's causing the fibroids to grow. And now what I'm doing is that's gone back in, so that DNA healing's over. Now I'm in your uterus again. And the reason why I do the DNA healing first is it gets that recipe that tells the cells how to behave back to normal. So now what I'm watching is I'm watching strands of fibrin. Have you ever heard of fibrin, Roxy?
No.
Fibrin is a protein that we need because it's a blood product that helps our blood heal, helps it coagulate, helps it clot. And it also produces fibroids, fibroids. And the fibrin are these little, it's a protein, and it looks like these little strings that reminds me of the strands that you'd see in a spider web. The spider uses to weave its web. And I'm watching them come out from the inside of your uterus. So we've removed the fibroids. We did the DNA healing. Now I'm getting the fibrin out of your uterine tissue. And it comes out from the whole inside. And it wraps in, looks like a cocoon. Have you ever seen a cocoon for a silkworm?
Yes.
Yeah. So silkworms have this drool that's a protein, and that's called fibroin. Humans is fibrin, silkworms is fibroin. And so that's what they make silk thread out of. So I'm getting that. It's wrapping into a cocoon. We're removing it. I'm shooting energy through you again. This should help with that. But the first thing I would do would be go find a doctor that can help you balance your hormones. And you only want to use the bioidentical hormones because those are the molecular composition of what our bodies make. Okay, you don't want to do the synthetic hormones. You want to do the bioidentical to get back on a level playing field with your hormones. So you just got a big old healing there, girl, on your girly parts. So yeah, keep us posted. Let us know how you're doing.
I will. And
okay.
That's with that treatment, it will be enough to help.
It's going to help. The way these energetic healings work is it happens on the energetic level, and then it'll integrate into your body, and that may happen instantly. It may take days, weeks, months, may need some kind of complementary care. I'm being led to tell you to find a doctor that can help you with the hormones. And so that with the energetic healing, I'm not saying you may not need surgery eventually, but that's your next step is what I'm getting.
Okay. Thank you so much, Julie. I appreciate it. Thank you for the healing. All the best over there. Big hugs.
You too. Take care. Bye-bye. All righty. Let's go to Natasha next. Hi, Natasha.
Hey, Julie. Thank you so much for taking my call.
You're welcome. How are you?
I'm doing okay. It's been a little bit of a rough week. I lost an old friend over the weekend, and
I'm sorry.
It hit me a little bit harder than I would have anticipated. So, just trying to get through that and a few other things. But I do have a question for you on a different topic. My husband and I have been trying to conceive our first child for some time now, and I've been going through some medical stuff with my thyroid and my hormones, and it's just been difficult trying to surrender and turn over the outcome to the universe, if you will. So I'm hoping that you can connect with our spirit babies, tell me a little bit more about our conception contracts and what they think that we can do to support them and kind of just get this show on the road, if you will.
Yeah, absolutely. Natasha, where are you located?
I am in Apopka, Florida.
Okay. And have you read my book, Angelic Attendants, yet?
I have not.
All right. Email me, julie@askjulieryan.com, and I'll send you a copy of it. And I think it will help bring you comfort with the loss of your friend. I'm so sorry about that. But so email me, julie@askjulieryan.com, and I'll send you a book. And hopefully that will help. Yeah, and feel free to share it with their family or others.
Yeah.
That's the whole mission.
You said that
to provide comfort.
Because I was definitely on the same frequency there. I was planning on doing that as well, even though I haven't read it. So thank you.
Yeah, you bet. Okay. All right. So what I'm going to do is get you on my radar. Here we go. Here comes my laser beam heading south again. It's going behind me. And then, all right, I've got you. Okay, there are two spirit babies, two baby spirits, I should say, that are above your right shoulder. They look like little orbs, Natasha, that you'd see in a photograph. Yeah. And they're not twins. They're spaced out. They remind me of planes coming in to land at night when they have their landing lights on, and they're spaced out. They're waiting to get clearance to land. So we've got that. Let me look at your girly parts, see what's going on. I'm going to look at your eggs and stuff. Baby spirit's going to attach to the mom's energy field years before they incarnate.
Yeah.
How young are you, Natasha?
I've felt them for many years. I'm 27 years old.
You're 27. Okay.
I am.
All right. So here we go. So I'm looking at you from behind. You got plenty of eggs. I'm in your left ovary right now. Eggs look like blonde caviar to me. Baby eggs, which is hilarious. And then, on women that are getting near the end of their childbearing years, I see little eggs that look dark, and those aren't viable, but you got plenty of caviar in your left ovary. Let me look at your right ovary. See what's going on. Yeah, there's plenty there. All right, I'm running the tubes. I'm in your right fallopian tube, roto-rootering that, making sure everything's clear. Okay, left tube, doing that, coming down into your uterine cavity. All right, you look good. Yeah, I'm not seeing anything that's giving me cause for pause there. So, baby spirits, what's up? When are you going to be ready to be born? When our mom relaxes. All right. Easier said than done. All right. Okay. I'm saying to meditate daily and just let go of outcome. Wow. Just meditate. What I'm hearing is your cortisol levels are too high because you're stressing about it.
definitely. Yeah, that's why I came and talked about surrendering. I'm actually in the middle of reading Spirit Babies.
Good.
So,
good.
Yeah.
All right. Well, email me and I'll send you one of my books and let us know when you get pregnant. Thanks for calling.
I appreciate you, Julie, so much.
You bet. Everybody, you're listening to the Ask Julie Ryan Show. Stay with us. We'll be right back after the break and see who's next. Welcome back, everybody. Let's go back to the phones. And our next caller is Tracy. Hi, Tracy.
Hey, Julie. How are you tonight?
I'm well. How are you?
Good, thank you. I'm calling from Raleigh, North Carolina.
Okay, terrific. How may I help you?
Moldy old Raleigh, North Carolina. Yeah.
Oh, geez.
A couple of general questions. How do I find out if you are on the radio some evenings and when you're not? Sometimes I've called in and you haven't been on.
If you look on any of my social media channels, which is Ask Julie Ryan on Instagram, Facebook, Twitter, what else? Pinterest, YouTube. YouTube, we don't post on that. We just post the shows. But we'll always post, okay, call in tonight, and then here's the numbers. And if I'm not going to be on, then on a live show, I will have pre-recorded a show, usually a few times a year if I'm on vacation or it's the holidays or something. Like last year, both Christmas Eve and New Year's Eve were on Thursday night. So I pre-recorded shows for those too. And we'll post it on the social media that'll say, hey, no live show tonight. So
gotcha.
That's how you can tell.
I check your website. So, okay.
Yeah.
I knew I was missing something somewhere. So, all right. Also, I had 2 growths on my thyroid, and you removed one of them, and that's what we thought. And then I went to get my yearly sonogram, and boom, one was gone. So thank you. You did it.
Yay!
Yay, you.
Yay!
So there's your update. So congrats. High five. Okay, I'm calling to see where my father-in-law is in his transition.
Okay.
And
what's his name, Tracy?
Norm, or Naomi.
Norm. Mm-hmm. All right, Norm. And where is Norm?
Holly Springs, North Carolina. He's half an hour, 40 minutes from where I am.
Okay. Holly Springs. Okay. All right. What I'm going to do is I'm going to connect to you and from you to Norm. Mm-hmm. Does he seem like he's dying, or what's going on with him?
His brain's good, but his body is kind of shutting down. So he has a lot of issues, ailments. They can't balance his blood. He has big heart issues, dizziness, swelling. Mm-hmm. He's been in the hospital and out since August. He's been in and out 3 times.
Oh, geez.
So just wanted to know where he's at. I'm trying to get him to do some paperwork. So I wanted to know how.
He's in phase 7 of the 12 phases of transition. For those of you that don't know what Tracy and I are talking about, is as we're dying, there are 12 phases that we all go through. Everybody goes through, whether it's quickly, like in the case of a homicide or suicide, or whether it's prolonged over days, weeks, months. And it's a configuration of angels and deceased loved ones, spirits that are there to welcome us to heaven. And I call them the Welcome to Heaven Committee. Have you read it? You've read Angelic Attendants, haven't you, Tracy?
I have. Yes.
Yeah.
Yes. It's very good.
So that'll give you some information for that. So phase 7. So let's ask him. I always ask people 3 questions when they're dying. Norm, are you ready to go? He's saying not really. He said not really. So sounds like he's on the fence with that.
Yeah.
Are you ready to go? Are you in pain? He says at times. A lot at times is what he said. And what do you need? More pain medicine. So maybe you can help him with that.
Okay.
Is hospice involved, Tracy?
Nope. He's not at that point. But like I said, his brain's there, but I see his body's withering.
Well, hospice can last a long time. Most people think it's just at the very end. Go on my YouTube channel, Ask Julie Ryan, and watch I want to say episode 239 with Chris Kerr, who's a doctor, who's a hospice doctor, who wrote a book called Death is But a Dream. And it's about, he did university-based research that showed close to 90% of his hospice patients report seeing the spirits of deceased loved ones and deceased pets at the end of their life, either in dreams or in visions. So it validates everything I talk about from the spiritual side and angelic attendants. But he spends a lot of time, I asked him pointed questions about what does the family need to know and when is it time to call in hospice and or palliative care first and then hospice. So watch that or listen to it. And I think it's going to give you some information that will help. So I believe it's episode 239.
Gotcha. But I should be able to pull it up by his name as well.
Yeah.
Also, is he going to be with us in the fall time or you can't tell? Because I know people go through their transition at different times.
Well, let's ask him, how long are you going to stick around for a while? I don't think he's determined that yet, Tracy. I think it's not, and it has not been my experience. You know how a lot of schools of thought are that we come in with a contract and we're going to exit on May 6th, 2021 at 7:56 p.m. Central Time. Yeah, that's not my experience. Like with my daughter-in-law, Mallory's grandmother, she was fine until they were going to put her in a nursing home, and she's like, "I'm not going there. Yep. I'm out of here."
Yep. That's what Norm's sister did in August. Same thing. She's like, "Nope, not doing it."
Well, it was
so funny. I was sitting there with Norm's sister, and I was thinking about you, and I said, "Okay, Julie, I'm going to use your technique." And I said, "Okay, Aunt Teddy, what do you think?" Because the nurse came in and the nurse said, "Oh, Teddy's not going anywhere." And what popped in my head in 0 seconds was, "That's what you think." And I said, "Okay, that's Julie telling me that that's Aunt Teddy's spirit talking to me." And sure enough, I gave it a chuckle and I go, "I'm sure this is right because Julie's been teaching me." And I went home, and when I walked in the door, I was 20 minutes away from hospice. My husband called me and said she passed away. And I said, "Yep, she did," because Aunt Teddy said, "That's what you think."
That's right.
But her breathing was excellent and everything was on spot. And so when they said, "She's not going anywhere," and boom, "That's what you think," and that wasn't my thought. That was Aunt Teddy.
Well, my Mima, I fed her a full dinner. She drank a cup of coffee and ate dessert, and then was dead an hour later. I guess she wanted to go to heaven on a full stomach. It was wild. Yeah.
She wasn't missing out on that meal.
And the other one that I think of all the time, too, Tracy, is Carrie Fisher. When Carrie Fisher died, and her mother, Debbie Reynolds, died the next day, and there wasn't anything wrong with her.
Gave me goosebumps. Yeah, you gave me goosebumps.
So my
thank you. You were there with me. So,
I'm so honored.
You were.
My experience is we all decide when, where, who's with us, what the circumstances are, and this whole thing about, you have exit points, and that's not been my experience. So not to say that isn't the case, but it's just not what I've ever seen, and I've worked with hundreds of families.
Well, thank you for sharing you with everybody. I appreciate it.
Good luck. Okay. Thanks, Tracy. Take care. Everybody, we're going to take a quick break. And when we come back, we'll go back to the phones and get some more callers on. You're listening to the Ask Julie Ryan Show, so stay with us. We'll be right back after the break. Welcome back, everybody, to the Ask Julie Ryan Show. I'm Julie, your host, and we do this show every Thursday night at 8 Eastern, 7 Central, and 5 Pacific. The call-in number is 712-775-7035, and the access code is 483-620-pound. Now, this information is available on my website at AskJulieRyan.com and in the show notes anywhere you download podcasts. We are also on YouTube and Alexa. So please remember to subscribe and leave a review at ratethispodcast.com/Julie. That's ratethispodcast.com/Julie, and you'll be entered into a drawing for a free 1-hour session with me valued at $200. So ratethispodcast.com/Julie. Call-in details can also be found on Instagram, Twitter, Facebook, and Pinterest at Ask Julie Ryan. And as I was mentioning before to Tracy, we post something the day of the show, and it says, hey, remember to call in, and it'll have all the call-in numbers. And if you go on AskJulieRyan.com and you sign up for my weekly newsletter, it's a question somebody has submitted that's chosen each week, and then I'll write an answer, and we send it out on Wednesday nights with a reminder that to call into the show if you have a question, and all the call-in numbers are there. So I'm trying to make it easy for you. It's all those places. While you're on my site, you can also schedule an appointment with me, and then we'll have a whole hour to talk about whatever you wish. And that can include medical. I can scan your pets. We can talk about past life stuff. Sorry, let me turn off my fan there. It gets hot in this room. I got the HVAC guys coming in to put another vent. So sorry about that extra noise. Randall won't be happy with me, the man behind the curtain. I forgot to turn it off. So I turned it on during the break so that you don't want a sweaty presenter. You want a sweaty host. That's not cool, especially when it's a girl. Anyways, when you're on my website, schedule an appointment, and we'll have a whole hour to talk about whatever you want. We can talk about medical stuff. I can scan your pets. We can talk to deceased loved ones. We can do past life stuff, whatever. So everything you need to know is at AskJulieRyan.com. By the way, angelic attendant training finished April. It was fabulous. July is full. I have a couple of spaces left for October. So if you're thinking about joining us, that'll be the last one of the year. So go on AskJulieRyan.com and sign up for that. Okay, let me put on my glasses here so I can see what I'm reading. Brooke from Raleigh, North Carolina asked, hi, Julie. I'm 23, and for the last 6 years of my life, I've been dealing with a debilitating health condition that I can't seem to get to the bottom of. I'm constantly dizzy, have developed a severe balance disorder, feel intense pressure in the back of my head, and have headaches 24/7. My vision is messed up in both eyes, and I hear a loud ringing in my head. Can you please, in all caps, can you please help me figure out what's causing this and what I need to do to fix it? I would literally do anything to have some of your guidance. I miss my life more than words can explain. Thank you in advance. Brooke, and here's my response. Hi, Brooke. Thanks for your note. I hate that you've been having so many health issues. In order to get some information for you, I energetically connected to you and saw in my mind's eye what looked like a lot of scar tissue in your head. Have you been in a car accident, fallen off a horse, or had some other type of trauma that could have caused one or more concussions? To help you heal, I watched, again in my mind's eye, an energetic healing occur where the scar tissue in your brain was removed and stem cell energy was used to generate new brain matter. Once that happened, your neural pathways lit up, and they look like laser beams crisscrossing your brain. Please go to Amen Clinics, Amen like Amen at the end of a prayer, A-M-E-N, amenclinics.com to learn more about how to heal concussions. Dr. Daniel Amen is an expert on brain injury and how to treat it. I believe you'll glean some useful information on the Amen Clinic's website. You may even want to schedule a consultation with them. Hope this healing and information help you feel better. I was at Amen Clinics in Atlanta on Monday and Tuesday this week, and some of you may have seen a picture I posted of me getting my brain scanned. And I went over on a recon mission because I wanted to see what went on, because I scan a lot of people who have scar tissue in their brains, and whenever I see it, I remove it and then help regenerate new brain matter with stem cell energy. And the reason we want to remove the scar tissue from our brains is because when I see somebody that has dementia or Alzheimer's, their brains are full of scar tissue. So whenever I see it, I remove it. And I've been in a couple of car accidents that were pretty healthy car accidents, and also have fallen once as a kid and then once as an adult that were pretty good falls. I know when I was a kid I had a concussion, even though I never hit my head in any of those instances. So I thought, I'm going to go get my brain scan. I can see what they do and how they do it, and at the same time, let's see what's going on. Maybe I can make myself smarter. who knows? So I'll keep you posted on that. But if you go to my Instagram feed, Ask Julie Ryan, you'll see a picture of me. Actually, it's a video of me getting my brain scanned. So they had me wrapped up like a baby burrito. It was pretty funny. Okay, let's go back to the phones. And our next caller is Angelica. Hi, Angelica. Hi.
Hi, Julie. How are you?
I'm well. How are you?
Great. Thank you for taking my call.
You're welcome. Where are you located?
I am in Capitola, California.
Capitola. All righty. What's going on out there?
Well, it's gorgeous, of course, but
yeah.
I'm calling about my sister.
Yeah.
And 2 weeks ago, she went missing.
She went missing.
She went missing. She wouldn't respond to any of us. And I got my mom and her daughter to go find her.
Mm-hmm.
And she went to check herself into the ER.
Mm-hmm.
And she's been there for 2 weeks. And I was hoping you could scan her.
She's been in the hospital for 2 weeks?
Yeah.
Okay. And what's going on with her? What are you hearing?
So what they're telling us is that she has sepsis.
Oh, gosh. Okay.
She went in there because she had a cyst between her neck and her back for 2 weeks, and she didn't tell anyone, so they did a surgery to remove it, and she's been swollen ever since.
Okay. All right. So what's her name, Angelica?
Her name is Mary Helen.
Mary Helen. Okay, I'm going to connect to her from you, and I will ask her permission to scan her, and we'll see if we can figure out what's going on. I'm hearing some tapping in the background. Are you typing on your computer or something?
No.
I don't know what that is. Okay, weird. I don't know. It's probably the spirits and beyond listening to our call. Okay, enough. Here we go. Here comes my laser beam out to you. Okay, got her. Mary Helen, I'm talking to your sister. May I scan you energetically? Yes. Okay. Yeah. Her spirit's out of her body. She's in phase 4 of the 12 phases of transition. I want you to Google this name. It's David Merrick, M-A-R-I-K, David Merrick. He is a critical care professor at Eastern Virginia Medical School. He has come up with a protocol that is super affected with sepsis. Sepsis is the number one killer of people in American hospitals. 600,000 people a year die of sepsis in hospitals. His patients, he's lost like a handful in the last several years. And here's his protocol, Angelica. It's steroids, vitamin C, and thiamine, which is vitamin D. Cheap ingredients. They work great. David Merrick, M-A-R-I-K. Google him. Contact him via email if you need to. Get her doctors that information about him. It works great. Okay?
Thank you so much. And so
you bet.
Do you see her having Alzheimer's as well? Or is there anything you can do to help heal her? Or because there's a lot of things wrong with her.
Yeah, when her spirit's out of her body, Angelica, I can't get a read on it because the spirit's the power source for the body. So it's like looking at an X-ray in a pitch black room. I can't see anything. Okay. So we can talk to her spirit. Are you ready to go? No. Do you have Alzheimer's? No, but I'm getting dementia. Maybe not as severe as Alzheimer's. Maybe it hasn't gone to that time, that severity yet. What do you need? She's saying antibiotics. I'm sure they have her on antibiotics, but I'm telling you, this David Merrick, everybody that I recommend his information to it usually works great. So
we will definitely
check that
get a
out.
Hold of them. She's in phase 4, though. Does that mean she's going to pass for sure, or if we get a hold of Merrick?
No, It doesn't. It means she's dying at the moment. I've seen people in phase 11 come out of it and live years later. live for years.
Oh, that is
so
so
she's
awesome.
dying at the moment. And so, get a hold of, at least get the website and get his information to your doctors, her doctors. Okay?
Thank you so much. Thank you.
You're welcome. Okay, take care.
Take
Bye-bye.
care.
Alrighty, let's go to Claudia next. Hi, Claudia.
Oh, hi. All right.
How are you?
I'm good. I want to take you off.
Good.
Here we go. Okay. Hello.
Where are you located?
I'm still in Georgia, Rankin, Georgia.
Okay. All right. I'm going to hold you over for the break, Claudia. We're going to take a quick break, and when we come back, we'll get what your question is. Everybody stay with us. You're listening to the Ask Julie Ryan Show. Welcome back, everybody. Before the break, we were talking with Claudia, easy for me to say, in Georgia. Claudia in Georgia. So, Claudia, you got a question for us?
I was on the line with you 4 weeks ago when Francis passed. That was 4 weeks ago tonight. And because I was his caretaker, I've been putting off some tests. And so I was wondering if you might be able to scan me and tell me where I should start. I'm considering going back to work, so I want to know if I'm up against any medical issues before I take a job.
Okay. Are you having any symptoms, Claudia?
No.
Okay. All right. Well, let me get you on my radar and let's see if anything pops up in particular. Okay. Here we go. Here comes my laser beam heading over to Georgia, just right next door to Alabama. All right. Got you shooting energy from your feet up through the top of your head. Yeah, I see inflammation. Looks like you're inflamed. Are you achy or are you feeling inflamed? I'm getting anti-inflammatory energy calming it down to see what's going on underneath. How are you doing diet-wise?
Diet-wise, I think I'm okay. I do have arthritis.
Okay.
And probably chronic inflammation.
Yeah, that's what I'm seeing. Email me, Julie at AskJulieRyan.com. I'll send you the link for the gut biome test. Get that done. It's a fancy name for a poop test. And it's going to tell you what the ecosystem is in your gut. That's where our immune system is based. And most inflammation, Claudia, comes from the gut. So this test will tell you, based on what the ecosystem is in your gut, here are your superfoods, here are the foods for you to avoid, here are the foods that are, going to be best for you. And I would do that. That would be my first step for you, is that get the inflammation down. And that's going to get rid of most symptoms, including the arthritis. Believe it or not, works great.
Oh, no, I believe that. I've been working on inflammation for quite some time. Okay, so you said to go to AskJulieRyan.com and do what? Email
me, Julie at AskJulieRyan.com, and ask for the gut biome test, and I'll send you a link, which will give you a little bit of a discount that you can get that done, and you can do it at home. You don't need a doctor's orders, and it works great. It's a game changer for most people. Anybody listening that wants that, just email me, and we'll get you a link.
Okay.
Thanks,
you very much.
Claudia. You bet. Take care.
Thanks.
Bye.
Yeah. Bye-bye.
Bye. All right, let's go to Jenny next. Hi, Jenny.
Hi, Julie.
How are you?
I'm okay, Julie. I have my husband here who's going to explain a little bit. He'll just give you a very quick background.
Okay.
Hi, Julie. This is Jenny's husband. She's not in the condition to talk, so I'd like to do the talking here. She's experiencing a lot of pelvic area pain, like a lot of muscle pain, muscle weakness, and nerve pain. She actually had a surgery last year. It was an anal fissure surgery, and things went wrong in the surgery, led to an infection, led to another surgery and a series of infections after that. And she was bedridden for like 3-4 months. We were asked to do physiotherapy, but when we started the physiotherapy, it led to nerve pain, and then we were told to meet a neurologist. She suspects there's a nerve-related issue, but we have no direction. And she's in terrible pain all day, can't move around much, but like everything in the pelvic area, and then some of the pain also goes to her head. But we have no idea what's going on and how to fix this.
Oh, wow. All right. And what are the doctors saying? What are her surgeons saying?
So the surgeon who performed the surgery abandoned her, so we moved to Indiana. We found a new surgeon. Geez. He said, get physiotherapy done. So we got the physiotherapy started, but that led to some nerve pain. And then he directed us to meet a neurologist. And now she wants us to meet a urogynecologist because she suspects something is going on in the pelvic area with the nerves, but she's not sure about it. So we're still waiting for an appointment with the urogynecologist. But there's too much tightness, weakness in the pelvic area, a lot of nerve pain, and she's not being able to move around much for that reason.
What I'm seeing is, and I've got her on my radar, what I'm seeing is a lot of scar tissue, a lot of scar tissue. And scar tissue looks like a cross between chicken cartilage that you see in a chicken breast with the bone in and that fake spiderweb stuff that you see at Halloween, that you can spread it out and hang it in the corner to decorate for a Halloween party. So what I'm doing is I'm cutting that out of her pelvic area right now. That's what I'm seeing. I'm not seeing inflammation. I'm seeing scar tissue that's not allowing movement. It's like if you have like some string that's tying something together and it can't move. So I'm cutting it energetically so that it can move. So hopefully that will help. I'm not seeing an infection. I'm not seeing inflammation. I'm seeing scar tissue. So hopefully that will help. Yeah. Hopefully that will help some. Okay. Thanks for calling. I hope you feel better. Bye-bye.
Thank you.
You bet. Okay, let's go to Deidre next. Hi, Deidre.
Hi. Sorry, I had to take you off the speaker.
That's all right. I'm well. How are you?
I'm great. Thank you. I'm calling from Vashon Island, Washington.
Terrific. Got a question for me?
Yeah. So I have a daughter. She's 19, and she has autism. She's very high functioning, and she's very moody. And she also, she's not happy, and we have her on different medications, and I try and do spiritual work with her, get her to meditate, deep breaths, that kind of thing. It hurts me as a parent. Obviously I can't do anything, to change that. And we just love her.
Deidre, I'm going to have to hold you over for the break. We're going to take a quick break, and we'll be right back. You're listening to the Ask Julie Ryan Show, so stay with us, and we'll hear more from Deidre. Welcome back, everybody. Before the break, we were talking with Deidre, and she lives up in Washington State. So, Deidre, tell us again about your daughter. You said she's high functioning. She's 19. She has autism. What else did you want to tell us about that?
So she just doesn't like herself very much. And I just would love some help, with her spirit. We love her and accept her for who she is. She just doesn't love herself. And so, I've tried to guide her, to learn to love herself better, but I was hoping maybe you could help a little bit with that, with her soul or her spirit.
Yeah. Tell me her name, please.
Lily.
Lily. Okay. All right. So Lily. All right. What I'm going to do is I'm going to connect to you and from you to Lily and see what's going on. I'm getting that it's a brain thing that's going on with her. And I was just talking about myself being over at Amen Clinics in Atlanta, and there's an Amen Clinics outside of Seattle. in Bellevue.
Okay.
That you may want to get her in to be seen. And what they do, Deidre, is they'll do a SPECT scan, which is different from an MRI or a CT scan in that those tests check the physiology of the brain. They're looking for tumors and things like that, whereas a SPECT scan shows different parts of the brain that light up with different activities, and it shows which parts are under functioning and which parts are functioning at their optimal level. And it works great. Dr. Amen does a lot of work with athletes and veterans and people that have been in car accidents. And what they find is that depression and other what we would consider to be mental illnesses really have a physiological source to them. And so so let me connect to Lily and get her on my radar and see what's going on. Has she been in any car accidents, or did she play sports?
No.
Has she fallen? Anything like that?
No.
Okay.
No, but, something that I've always wondered about. When she was born, I delivered her vaginally. But I've always wondered this. When I was in labor, my OB he thought he was like poking my water, but it was really her head.
Oh, geez. Okay.
He thought he was breaking my water, but he scarred her head. Like we didn't need stitches because she was just a newborn, but there's a scar on the top of her head from it still at 19. So it definitely did something. And I've just always wondered, because I was really healthy. Like, she came on her due date. Like, there was nothing indicative of in the pregnancy, and it's just interesting that you would mention brain. Although I do know that autism actually is like, the neurons are not firing, which is what actually, does cause it. So,
well, the reason I'm asking is she has scar tissue in her brain, like the letter from Brooke in North Carolina that I read. That was my blog this week, and that was the letter that I answered the question. She's got scar tissue in her brain. So while you've been talking, what I've done is I've scooped it out. I've put stem cell energy in there. Those neural pathways are lighting up better. And they look like laser beams that crisscross a room as part of a security system in a museum that guards the paintings and the statuary and the artifacts and things. I would get her into Amen clinics to be seen. I'm so impressed with them. I'd say I went over to do some recon on my own brain in Atlanta, and since they have a center close by you, and what they can do is they help heal people's brains with sometimes it's medication, but most of the time it's not medication. It's different supplements and things like that they've found, really work great to help people with depression and other focus issues and ADD and things like that. They work with a lot of autistic kids. So I would check that out. The website's amenclinics.com, amenclinics.com. Yeah. So I would try that. In the meantime, hopefully this will help. I don't get that it's a spirit thing. I get it's a physiological thing with her.
Okay. All right. Okay. Well, that's so great. I'm so thrilled to get some more, tools. So I will definitely reach out to them for sure.
Okay, and use my name too, Deidre, because they'll give you a discount.
Oh, okay.
Because I send
Amen.
So many people.
Amen Clinic.
Yeah, Amen, like amen at the end of a prayer, AMEN, Amen Clinics.
Okay.
And just tell them that Julie Ryan recommended you, and they'll give you a discount. I just negotiated that with them when I was in Atlanta. I said, I sent so many people to you guys. You need to let me offer a discount to people. I don't make any money off of it, but if it saves you money, what the heck?
So cool.
I'm all for that.
Yeah, and it's great that they're close to me too. That's like a 20-minute drive from here. So that's awesome.
Yeah. Okay. Terrific.
Okay,
keep us posted. Let us know how she does.
Julie.
You're welcome.
Okay.
Take care.
Thanks.
All righty. Bye.
You too. Bye.
All righty. Let's see who's next. I believe it's Adele. Hi, Adele.
Hello.
Hello.
Hi, Julie.
How are you?
Hi, Julie.
How you doing?
I'm doing fine. How are you doing?
I'm great, thanks.
Oh, so
where are
good
you?
to hear.
Where are you located?
I'm in Farmington Hills, Michigan.
Oh, outside of Detroit, out of Boatown.
Yeah, yeah.
Yeah. I have a girlfriend that used to live there, so I've been there many times. Not many. I've been there several times.
Uh-huh.
So, yeah,
well, good.
Wonderful.
You'll have to come back again.
I know it. Just not when that white stuff's on the ground. I don't do snow.
No. I understand. Yeah.
Yeah.
No white stuff now. Yeah.
I know. That's true. Yeah, you should have lots of blooming things that should be gorgeous, I would think, at this point.
Yes. Yep. Everything is in bloom now.
Great.
Mm-hmm.
Well, you got a question for me?
I do have a question for you. A couple months ago, you had told me that I have a mold and a yeast problem.
Oh, okay.
And I went back to my doctor because this has been going on for a long, long time, trying to figure out what it is. And she still doesn't have any evidence yet with the blood work.
Yeah.
And the tests have not come back. But
yeah, she probably won't have any evidence. You treat it, and then you get better, and that's how you know that there's a problem there with that stuff. So you could be waiting till the cows come home.
I have been, you told me about the diet, so I've been on the diet for a couple months. And with the mold, I have been, I don't know if it was mold from food, but I've been really cleaning my bathroom around my shower. I don't know if it's the same type of mold. And I did get a little bit of nystatin, but I could only take it for a week. I kind of got sick on it. Mm-hmm. So I'm wondering if you could give me a scan.
Sure.
And you could see if it cleared up just a little bit. And also if it's in my ears and in my throat.
Are your ears itching?
They are, yes, they do itch when it is, it's been very rainy here. Mm-hmm. And so in the spring and the fall, it gets, they get itchy.
So it releases the mold spores in the air. Yeah. The nystatin, the reason why you were feeling kind of sick on that, Adele, is because of the yeast die-off. And they're releasing all their toxins into your system. Mm-hmm. So nystatin is nectar of the gods when you have yeast. I mean, that is the missing link most of the time. Nystatin, everybody is an antifungal that kills yeast on contact, and it's what they give babies when they have thrush. Been off patent for probably 50 years, Adele. It stays in the GI tract, no known side effects, and it really works great. But the first week or so, there can be enough die-off, and the yeast is known to have 99 toxins in the candida. And imagine when it's dying and all those toxins are going into your body's going, what the heck is this? So that's that. So let me get you on my radar. Here comes my laser beam from Sweet Home, Alabama to that state up north. I'm a Buckeye, so we don't say the M word. As a graduate of the Ohio State University, fourth generation graduate. So I'm just kidding. There's a big rivalry.
It's okay.
Big rivalry. What if you guys don't know what we're talking about between Ohio State and Michigan?
I do.
So
yeah,
I know, but other people listening may not know what we're talking about. It's kind of like an inside joke here. All right, got you. Yeah, you still got mold in you, and you got yeast. Wherever there's mold, there's yeast. So I'm clearing it out. Yeah, you got to do a mold test in your house. Go to the Home Depot or someplace, get a mold test, and do it. Homebiotic.com. Also, Adele, I think I sent you that link. Homebiotic. It's like an antibiotic for the home, and it's a bacteria that eats mold. And so you want to go on that website, homebiotic.com. They have a test you can do in your home too, but you can get them on Amazon. You can get them at the Depot, Home Depot or Lowe's or, places like that. So hopefully that will help. And I cleared it out again. Get back on the nystatin. And your doctor's not going to probably find the test results for yeast, but you're going to feel better. if you do that.
Okay.
Hope it helps.
Yes.
Thanks for calling.
Thank you so much.
You bet. Take care. Bye-bye. Okay, everybody, we're going to take a quick break. When we come back, we'll get somebody else on, see what they have to say. You're listening to the Ask Julie Ryan Show, so stay with us. We'll be right back after the break. Welcome back, everybody. Let's go to the phones, and our next caller's Mark. Hi, Mark.
Hi, Julie. How are you?
I'm well. How are you, sir?
I'm doing good. I'm calling from Safety Harbor, Florida.
Okay, terrific. Well, welcome. Thank you for your patience.
Well, thanks for taking my call.
You bet. Got a quick question for me?
Yes. Today I went down to the guide dog organization to see Jeeves. He was he's a 2-year-old golden retriever lab mix that I raised and returned to the guide dog organization back in November. And he recently got diagnosed as having diabetes insipidus, so he got transferred out of the program. I didn't feel like I could adopt him because of my current living situation, so I just wanted to go down and have the closure with him. When I visited him, he seemed kind of distant from me. He didn't have as much eye contact as we usually have together. So I just wanted to see if you could let him know that I love him and possibly you could facilitate some healing with him.
Sure. Yeah. What I'm going to do, Mark, is I'm going to connect to you and then from you to Jeeves. I love his name. It makes me think of the butler, Jeeves. Yeah. What a great name for a guide dog, for heaven's sakes. My gosh. Did you come up with that or did somebody else?
No, somebody sponsored him and named him that.
Oh, my gosh. That's fabulous. All right. So here we go. Here comes my laser beam. Head down to you in Florida. Got you. Okay, got Jeeves. He's sick. He's not doing well. His little spirit's out of his body. Mark, he's really sick. 2-year-old with diabetes. That's pretty young, isn't it, for a dog? I don't know that I've ever heard of that. Yeah. Okay. So right now he's dying. I know that's not what you want to hear, but yeah. That's why he wouldn't look you in the eye, because he feels so badly. Yeah. Oh. So questions for him? Anything you want to say to him or anything you want to find out from him?
Just that I love him. Just tell him I love him.
He said, this is so cute. He said to tell you that you are his favorite human of all time. How cute is that? You're his favorite human of all time. All right. Anything else that you want Mark to know? You did everything perfectly. He doesn't want to live with you because you can't afford his care. And but his spirit will be around you if he doesn't decide to stay here. You know, spirits, dog spirits and animal spirits do stay around us. It's pretty amazing how that works. So you can communicate with him telepathically now, Mark. Just say something to him in your head or aloud, and he will answer you, and it will come in a second. When a response comes in within a second, you'll know that that's from Jeeves. If you think about it for more than a second or so, that's going to be your brain talking to you. Okay, so you can talk to him, and he's telling me that he's going to let you know when his spirit's around you. He's saying that pay attention because you're going to think you hear his nails on the tile. You have tile floor in your house?
Yeah, we have some tile.
Yeah. So you know how the dog's nails on tiles, you can hear them clicking, kind of. Yeah. He's saying you'll hear his nails on the floor. His spirit. So I know that's not what you wanted to hear, but that's what I'm getting right now. Now, that doesn't mean he's going to die. It means he's dying right now, and future events are fluid. There are a bazillion things that can change, but that's what I'm getting right now.
Oh, okay.
Okay.
Well, thank you for
You're welcome.
Taking my call again. Okay.
You are so welcome. Okay, take care. Bye-bye. All righty, let's go to Natalie. Hi, Natalie.
Hi.
How are you, girl?
Oh, I've been better.
Uh-oh. What's going on?
I'm a first-time caller. I'm from St. Louis, Missouri.
Okay.
And I was referred to you by my mom.
Go ahead.
I have been suffering from chronic pain and fatigue and IBS and bloating for a long time.
Mm-hmm.
And I've seen every alternative health practitioner and spent thousands and thousands of dollars on this. And I'm extremely healthy otherwise. I'm a yoga and meditation teacher, and I do hot yoga, and I train like an athlete almost. So this stuff doesn't make sense. And and now Spirit has called me to live my dreams finally, and I'm doing my calling on a higher level now. So I can't afford to live like this. It's ruining and running my life.
Yeah, you're full of yeast. You know, it's the missing diagnosis. IBS is yeast overgrowth. So email me, julie@askjulieryan.com. I'll send you the link for the gut biome test. Do that first. In the meantime, I'm going to get all the yeast out of your system. Get somebody to prescribe nystatin for you. NYSTATIN. It's the antifungal we were talking about earlier with Adele. And you will be a new woman. So
oh my God.
That's what's going on. Yeah.
So email you and
email me. I'll send you the gut biome link. It'll tell you what are the best foods for you to eat based on your gut biome. It will help you get a healthy gut biome.
Okay.
That's what's going on. Okay. Take care. Hope you feel better.
Thank you so much.
You bet. Give your mom my love.
Okay.
All right. And here's our second Natalie. Hi, second Natalie.
Hey, Julie. How are you?
I'm well. How are you, girl?
I am okay. I'm calling about Amara. She has been diagnosed with diabetes at 9 months old, and I wanted to know if you can scan her. We just spent 9 days in the hospital, and it's a scary time right now.
Oh, my gosh. Please tell everybody where you're located.
Fort Lauderdale, Florida.
Okay. And Amara's your daughter. Here we go. I got her on my radar. Okay. I'm working on her pancreas. I will do a healing on her pancreas, Natalie, and let's see what we can do for that sweet baby girl. So we are about out of time. Everybody, thanks for joining us this week. To all the moms out there, I hope you have a wonderful weekend. And I know I will, because Jonathan's in town. And until next week, sending you lots of love from Sweet Home, Alabama. Bye, everybody.
Be sure to follow Julie on Instagram and YouTube at Ask Julie Ryan, and like her on Facebook at Ask Julie Ryan. To schedule an appointment or submit a question, please visit AskJulieRyan.com.
This show is for informational purposes only. It is not intended to be medical, psychological, financial, or legal advice. Please contact a licensed professional. The Ask Julie Ryan Show, Julie Ryan and all parties involved in producing, recording, and distributing it assume no responsibility for listeners' actions based on any information heard on this or any Ask Julie Ryan shows or podcasts.